Welcome back to SA Live at 124. Yes, it's raining here on Houston Street as we prepare for Tropical Storm Bill, maybe in our forecast. You keep it here on SA Live. We're live and local all afternoon. And spreading the word on vein disease is something we want to talk about today with the Hamilton Vein Center. They're new to San Antonio. Dr. Justin Smith is an interventional radiologist, and one of his success stories and patient, Mr. Johnny Burkhardt. Welcome to SA Live.
Thank you so much. Appreciate it.
Tell us what vein disease is, doctor.
So vein disease is essentially, when we talk about patients with vein disease, we're talking about patients that have reflux in some of the superficial veins of their legs. Common causes would be things like obesity would be one. Certain risk factors, such as hereditary factors. There's a FOX gene that you can actually get that makes it highly hereditary. If one first-degree family member has it, then we're talking 60% chance. When you get to two, then we're talking 90% chance.
So this is more than, we always hear about spider veins, we hear about varicose veins, we hear about those. It's more than a vanity issue.
Yes, it's way more than a vanity issue, definitely. Mr. Burkhardt here was suffering with a lot of different symptoms that we were able to effectively treat. And really, what we want to get the word out is that this is actually a progressive medical condition that can be treated very quickly and very safely in an outpatient setting,
And you may not know that this is happening. What were some of the symptoms?
Well, for me, the symptoms were swelling of the ankles and the thigh and the calf. It was really something that made me feel overweight and just not able to do anything, just
sluggish, really heavy on the bottom side.
and
I say that not jokingly, but I mean we all have junk in the trunk. But I mean when you well, thanks for checking it out. but you really do. I've been to the doctor and they'll squeeze your ankle just to make sure.
Sure.
So who's at risk for this?
So people at risk, again, people who have family members that are involved. Mr. Burkhardt here was also he's a retired law enforcement officer.
Yeah.
Here's some signs up here. Things that we look for when we're looking for venous insufficiency would be really the clinical symptoms. Now, what we're seeing up here on the screen is that we're actually seeing some of the physical manifestations. And these are things you can see on the skin. So things like bulging varicose veins, things like hyperpigmentation of the skin, edema, swelling, all that sort of thing. The other side that we really like to educate patients and even other physicians on is actually the clinical symptoms. And these are things like swelling, heaviness, achiness, restless leg syndrome, cramping at night. All of these symptoms can actually be highly associated with chronic venous insufficiency or vein reflux.
Okay, so if the answer to your, cramp in the middle of the night is eating a banana and it still keeps happening, you probably need to go see you.
Somebody.
Of course.
Or investigate this.
Yeah.
And what prompted you to go, dig a little deeper?
Well, part of the deal was being in law enforcement for almost 30 years. You're rather skeptical of some of the claims that people make, and having arrested a few doctors.
Everybody's always a criminal. You got to stop thinking like that, man. We're here to help.
The main thing is, when I went, it was an exceptionally experienced, well-managed office. Everyone there was very friendly. They knew their job, and they took care of me and all the other patients. And the main thing was, it works. It really does. And they told me first that one lady came in to have the procedure, and she participated in a roller derby that evening. I didn't participate in the roller derby, but I will tell you, I could have.
It goes back to that junk in the trunk thing.
Yes.
I understand that. But you feel better. And
absolutely. Immediately.
The procedure has come a long way, obviously.
It has come a long way. So about 19 to 20 years ago, you may have heard of something called vein stripping. This was sort of a barbaric medieval procedure that used to be done, and it really pushed people away from getting anything done about their veins and some of the symptoms that they were having in their legs. But now we have an outpatient procedure. Mr. Burkhardt comes in, he checks into our office. Within about an hour, he's walking out the door, or he can go home and roller derby if he wants to. He can do whatever he wants. That's the nice thing. And actually, we encourage patients to exercise and to walk after the procedure because it really helps with some of those symptoms and to help things progress in a good way.
Okay, so don't be embarrassed anymore. If you have issues and maybe you're just hiding them because you don't know what to do next, we would encourage a phone call, a consultation.
Right, we'd love that.
Come and visit you.
Yeah, definitely come and see us.
You're new to San Antonio.
We are.
To make sure you've been available here in Texas, so you've got a great reputation. You got lots of success stories, including Mr. Burkhardt. But if you have been hiding that or you have questions about it, we want you to visit the Hamilton Vein Center. Call 210-504-4304. That's 504-4304. You're online, hamiltonvein.com. sa-live.com. And again, don't be embarrassed to ask questions. There's nothing wrong with that. If you think it's a varicose or a spider vein, it just comes with, getting older. That may not be the case.
I noticed you're looking at me when you said that, but it may not be the case. But the main thing is, it works. Get it checked out, and they can do that procedure in the office. It takes about an hour, and it's well worth it.
Thank you, Mr. Burkhardt. Good to see you.
Same here, my friend.
Thank you, Doctor.
Jeff, thanks
Good to see you.
I appreciate it.
All right, straight ahead. More SA Live. Don't move. You might learn something.